Thank you so much. And it's truly a pleasure. And time is of the essence. So we are going to immediately start with the program. And so nice to have so many of you here in this room, and especially also live online, because let's not forget, we have a huge community also active participating online, and welcome for the people that are walking in. We are truly honored to be hosting tonight by UNICEF's Geneva offices, and our sincere thanks to UNICEF Geneva for the warm hospitality and the support in making this event possible. We really do it together. And it's now my pleasure to invite Ms. Annelies Borrell, Senior Advisor for Nutrition and Social Protection, to deliver her remarks. Welcome, Annelies.
Thank you very much, Sylvia. A very good evening to all of you who are here with us in the room this evening. And a good morning, good afternoon, and good evening to all of us joining us virtually from across the world. On behalf of UNICEF, it is a sincere pleasure and a privilege for me to welcome you all to this side event on large-scale fortification during the 78th World Health Assembly. We at UNICEF, together with our partners, are proud to co-host this side event, which aims to mobilize global action and attention to food fortification, 1 year ahead of the first implementation report for WHO Resolution 76.19 on food fortification, a resolution that calls for the accelerated efforts to prevent micronutrient deficiencies and related conditions such as spina bifida. In particular, I would like to extend my heartfelt thanks to our co-host governments, Bangladesh, Chile, Egypt, Pakistan, and the Philippines, for their leadership in advancing large-scale food fortification and for their invaluable presence at this event. Your commitment is truly inspiring. It's wonderful to see such a diverse group gathered here today. Member states, UN agencies, civil society, technical experts, and champions for nutrition, all of us united by a common purpose, making essential nutrients more available and accessible through food fortification everywhere. As many of you know, UNICEF takes a systems approach to improve the diets of children and women. That is, we recognize that it is necessary to leverage the food, the health, the social protection, the education, and the WASH systems to ensure that children and women get the right foods they need, are able to make the positive behavior changes in nutrition practices, and are able to access essential nutrition services. At UNICEF, food systems is a leadership agenda, and food fortification in particular is one of the most important interventions delivered through the food system, given its enormous potential to improve diets and health and nutrition outcomes globally. The work that will be described today demonstrates that food fortification must be firmly embedded within the food system narrative for improving nutrition. UNICEF is proud to work together with our partners, including WHO and GAIN and many others, to support the governments to plan and implement effective and sustainable food fortification interventions that have multiple benefits, including the prevention of spina bifida. Undoubtedly, 2025 is a landmark year for fortification. This year is a year of both opportunity and acceleration. Amidst global funding cuts and competing priorities, food fortification stands out as a cost-effective, proven, and scalable intervention that saves lives, improves health, and strengthens human capital, especially for the most vulnerable. We're seeing growing momentum. As of today, a total of 24 commitments have been made to food fortification by governments and agencies through the Nutrition for Growth process, including UNICEF's own commitment. Out of these 24, 17 have been made by governments across the world. This is just one commitment short of a total made by governments during the 2021 N4G summit. And we haven't even reached the final tally yet. we remain positive that the final commitments will surpass our expectations. This signals a renewed political will. It shows that even in tough times, countries are prioritizing food fortification as a smart investment in national development and as a critical intervention for transforming food systems. So let today be a moment of collective encouragement and strategic dialogue. Let us use this platform to spotlight the extraordinary leadership and progress that has been demonstrated in practice. Let us share and listen to the latest evidence and innovations. And let us identify ways in which we can even do more to close the gaps in legislation, in technical support, and in financing. Let the achievements shared today inspire other member states and partners to step forward and make new commitments, or strengthen and expand existing commitments to food fortification actions. Thank you once again for joining us. With your insights, collaboration, and energy, I'm confident that this event will be a success to drive real change and progress for better nutrition around the world. Thank you.
Annalise, thank you for those very inspiring comments. You told us about UNICEF and the systems approach and the important partnerships, and that 25 promises to be a landmark year. One small bit of housekeeping I've been requested by our very capable support folks are that if you're having any difficulty hearing the audio phone, that this can be your friend. This is a hearing aid device, so that if you're having difficulty, try this and the folks around can help us use it to maximum advantage if you need it. As Annalise has told us, 2 years ago, the WHA passed the resolution entitled Accelerating Efforts for Preventing Micronutrient Deficiencies and Their Consequences, including Spina Bifida, and other neural tube defects through safe and effective fortification. Please join me in welcoming a leader in the WHO efforts. And that word is absolutely right here. I'm friends with Kamel and learned the important role that Luz de Regil played in this process. It was central, it was essential. And so please join me in welcoming Luz, Director of the Department of Nutrition and Food Safety at WHO, for some welcoming remarks.
Now I don't know what to say after that. So thank you so much for the kind introduction. On behalf of the World Health Organization, I just want to convey our gratitude to the organizers for convening this meeting. I was thinking that, last time that we saw each other was 2 years ago. And it was a result of a lot of groups in the civil society and different communities in the civil society coming together to advocate for an intervention that helps multiple groups. Fortification. And I think that from that, both communities learned. They have learned from each other. They have shared experiences, and they continue advocating together to make sure that fortification remains central in the health issues. Gail, you say at that time, I wake up every day in the morning thinking about this resolution. I hope that now you wake up thinking that about how to accelerate the efforts. The task is far from being completed. We know that food fortification is cost effective, but we shouldn't think that it's cheap. And that is a key message. Food fortification requires investment in expertise, requires investment in ensuring that an adequate supply, requires investment in ensuring that there is quality assurance throughout the process, and enforcement and monitoring from the regulatory entities. Monitoring, reporting. So I think that while we have a great intervention at hand, and it has been proven to be effective in iodine, for example, iodine fortification, less effective, well, equally effective, but less coverage in other with other nutrients and other food vehicles. We need to make sure that we keep in mind the right cost of fortification, and we keep in mind how to make it better, how to make programs more successful, achieving more coverage, and having a good mixture of food vehicles to achieve different objectives and to ensure that nutrient requirements are met without exceeding the limits, which was one of the important items in the resolution. I just want to say that WHO remains fully committed to working with all of you to continue supporting the countries in their efforts in assessing the systems, the fortification landscape, in providing the right guidance. This year, we are hoping to publish, not hoping, aiming at, very committed, to publish updated guidance, implementation guidance on food fortification. Many of you may know the Orange Book, which is the guidelines for micronutrient fortification. This book is almost in its final stages with the contributions of, I don't know, maybe 100 authors from multiple institutions. And we hope that they will capture what are the relevant issues in fortification in this time, from better program design and planning, humanitarian settings, and social protection, digitalization, the role that digital technologies can play in fortification, monitoring, a very strong focus on regulatory monitoring. Before, we used to have a bigger focus on program monitoring. Now we are putting a lot of weight on also strengthening regulatory monitoring. And we hope that publication is going to be ready in Q3 after the summer. Is undergoing clearance, and of course the success of that publication will be that is useful and that actually helps improve the quality of the programs. If all that effort without actually effect in the programs, it would be a shame. So I hope that we can work with countries in disseminating, making sure that whoever is responsible for those programs understands the guidance. I'm sure that I count with all the commitment from the authors to ensure that we work together to disseminate and build capacity with countries, build a bigger community of fortification. That's a big aim. I see in all these years that I have been working in fortification, a changing community in the practitioners in fortification. More clinical communities, more women engaged, sometimes private sector engaged as well, even more engagement in some areas, which is good. This is a multi-sectoral effort, and different sectors have a different role and complementary role, and we need to acknowledge that. The second piece that is coming this year is also a commitment that a request that member states asked to the Secretariat, and is to produce a report on the status of fortification. What is where we are now, where countries are, and where we want to be in 2030. Those are the key questions. We are collaborating with different organizations to produce it. Importantly, is a multi-agency report. We thought it was critical that the UN agencies come together to produce a report that is helpful, but also situates fortification in the current context of food systems. We cannot understand fortification in isolation. It needs to be understood in the context of other policies that are to improve food environments, and of course the overall nutritional status of populations. So we are sure that we are going to depict several gaps because we have not achieved the coverage that we want. So, but also we hope that with that publication, we are going to be able to say not what only are the gaps, but potential solutions to address them. And of course, hopefully gather some commitment to overcome those spaces that we will see. So with that, I just invite you to continue coming together, to keep having these conversations. Our appreciation to all the hosts of this event. And I look forward to this conversation.
Thank you so much, and thank you for your guidance, most of all. And there's a lot of work to do, as you both mentioned, but it requires commitment. And that's why we're all here today. This evening, we are honored to be joined by representatives of governments that are not only champions of food fortification, but who are also co-hosts of tonight's event. And please join me in welcoming here upstage our distinguished panelists. Professor Dr. Jafor, Director General of the Ministry of Health in Bangladesh. Professor Dr. Abla Alafi, Deputy Minister of Health and Population and Chair of the National Population Council, Egypt. Dr. Malik Safi, Advisor, Ministry of Health, Islamic Republic of Pakistan. And Dr. Azucena Dayahirang, Assistant Secretary, Department of Health and Executive Director of the National Nutrition Council of the Philippines. It's truly exciting to have you all here. Please have a warm seat. We already heard about the commitments and the inspiring words and dialogues of which we're all invited to here in this room, online, after this meeting, but it starts now with this panel. So we begin with Dr. Dayahirang, as I know you have another engagement to also adhere to this evening. Please, Dr. Dayahirang. The Philippines has been a strong supporter of food fortification for many, many years. And you supported the World Health Assembly resolution on food fortification and recently made also a strong commitment to further strengthen fortification at the Nutrition for Growth Summit in March. But maybe you can share with us more about how you see the Philippines government's critical leadership role in creating strong, sustainable fortification programs that really prevent and reduce micronutrient deficiencies. The floor is yours.
Thank you very much. Distinguished delegates, esteemed colleagues, partners in global public health and nutrition, ladies and gentlemen, good evening. It is my honor to represent my country, the Philippines, as the head of the National Nutrition Council, the highest policymaking body and coordinating body on nutrition. At this important side event, as co-host with the other countries right beside me of the 78th side event in the 78th World Health Assembly. I am grateful for the opportunity to share our country's continuing commitment to address micronutrient deficiencies through large-scale food fortification. Micronutrient deficiencies, often referred to as hidden hunger, continue to undermine the health and nutrition among the millions around the world. The most vulnerable among us, including women of reproductive age, infants, and young children, suffer its consequences in silence. Preventing and reducing these deficiencies requires timely decisions based on scientific evidence and sustained government leadership. It is for this reason that the Philippine government has always recognized the critical role in shaping and implementing strong, sustainable, and equitable large-scale food fortification programs. We understand that policy, regulation, and public investments must go hand in hand with innovation and collaboration across all sectors. Over the past two decades, the Philippines has built a comprehensive national food fortification program. Our Food Fortification Act of the year 2000 mandates the fortification of staple foods like sugar, cooking oil, rice, and wheat flour with vitamin A and iron, and all food-grade salt with iodine. Further, a resolution on scaling up rice fortification with iron for social safety net programs in the Philippines was also passed. Now, recently, the National Feeding Program, mandated by Republic Act number 11037, provides fortified meals, particularly iron-fortified rice, to undernourished children in public daycare and and elementary schools, nutritionally at-risk pregnant women, and children 6 to 23 months old, operationalizing the first 1,000 days law in the Philippines. Now, these efforts, while not without challenges, have led to important gains. The National Nutrition Survey data from 2022 to 2023 showed a steady reduction in anemia and vitamin A deficiency disorders among vulnerable groups and adequate iodine nutrition among school-age children and women of reproductive age. Now, meanwhile, the prevalence of neural tube defects in the country is higher than the global average, while anemia still affects 10.9% of Filipino women of reproductive age. However, today, I am pleased to share that the Philippines is taking a major step forward by revising its wheat flour fortification standard by the World Health Organization guideline to include folic acid and the use of bioavailable form of iron. Now, this policy aims to prevent neural tube defects and spina bifida and accelerate the reduction of iron deficiencies anemia among vulnerable age groups. This reform is rooted in the country's commitment made at the 76th World Health Assembly in Geneva here in 2023. I was fortunate enough to read their manifestations and supporting the adoption of the resolution WHA 76.19 and NSC's commitment in the recently concluded Nutrition for Growth Summit in Paris. We are grateful for Nutrition International as well as the Food Fortification Initiative, which have provided sustained technical support for these measures. Our partners likewise at the Food and Nutrition Research Institute, Department of Science and Technology, also who conducted the stability and retention studies that provide scientific backing for the proposed policy. We know that for large-scale food fortification to be effective, it must be built on a foundation of clear regulation, strong enforcement, and technical and financial support for industry players. We are committed to strengthening these systems, supporting fortified food producers, and improving public awareness of health benefits of the consumption of fortified foods so that fortified foods are both available and demanded by consumers. At the heart of the national efforts is the Philippine Plan of Action for Nutrition, which is a costed plan for 2023 to 2028, which serves as the Philippines' national blueprint for nutrition action. This comprehensive framework emphasizes multi-sectoral collaboration across health, education, agriculture, social protection, climate change, industry, and aims to scale up evidence-based interventions to combat malnutrition, including micronutrient deficiencies. Finally, the call to action presented through this gathering underscores the urgency of scaling up coordinated and evidence-based food fortification strategies. In closing, I echo that what we believe in food fortification saves lives. But it takes political will, collaboration, and persistence to realize this. The Philippines stands ready to continue working with all of you to learn, to share, and to lead toward a future where no one child, no woman, and no family suffers from the preventable consequences of micronutrient deficiencies. Thank you very much.
Thank you, Dr. Dangirang, and especially for your support for tonight's event. And we understand that you have now another commitment and engagement to go to. So we move on now to hear from the government of Bangladesh. Professor Ghafor, to help accelerate the fight against micronutrient deficiencies, what progress has Bangladesh made in implementing large-scale food fortification programs?
Thank you very much. Assalamu alaikum and very, very good evening. On this side event of 78th World Health Assembly, all the dignitaries, ministries, and secretaries, my friends, partners, ladies and gentlemen. Bangladesh government actually made considerable strides in implementing large-scale food fortification program to combat the micronutrient deficiencies, particularly in edible oil fortification with vitamin A. Salt fortification with iodine, rice fortification with iron, zinc, folic acid, vitamin A, vitamin B1 and B12, wheat flour fortification with 10 vitamins and minerals. And we're working with the public-private partnerships, successful partnership between the government development partners like Global Alliance for Improved Nutrition Gain, United agencies like WFP and UNICEF, and private sector have been crucial for developing and implementing the fortification programs. We are trying to develop regulatory framework for standard monitoring, quality control, and quality assurance, including outlining the requirement for fortification level, quality control, and labeling through the three regulatory agencies named Bangladesh Standard and Testing Institute, Bangladesh Food Safety Authority, and Directorate of National Consumer Side Protection. Social safety net integration is very important part. Fortified rice in increasing being distributed through the social safety net programs like the Vulnerable Women Benefit Program and the Food Friendly Program, ensuring that vulnerable populations has access to more nutritious food. Industry engagement, significant engagement of the edible salt, oil, and wheat flour industries has led to increased compliances, especially among larger producers of packaged foods. Monitoring and quality assurance efforts are actually underway to strengthening the monitoring and quality assurance mechanism to ensure that fortified foods meet the required nutrient level to minimize and reduce the nutritional deficit and its consequences. Thank you.
Thank you, Professor Jaffor, for sharing these promising activities and interventions. And we will come back to you before we close out the panel. But first, there has been some exciting recent progress of food fortification in Egypt that should be highlighted. So turning to you, Professor Alalfi, Egypt recently relaunched the wheat flour fortification program. And many congratulations to the government of Egypt for taking that step. So maybe could you please share with us what the factors were that led to renewed interest, especially the political will to fortify after the program had been dormant for some time?
Thank you very much. First, I would like to sincerely thank WHO and UNICEF and all our fellow co-hosts for arranging this essential event. Micronutrient deficiency is really a very preventable consequences in our children, and we need to work very hard to save any child the risk of being exposed to micronutrient deficiency with long life risk and disability. The government of Egypt implementing the program in collaboration with the World Food Program and in partnership with multiple national stakeholders that are responsible for the joint implementation of the program, as well as the joint monitoring of the program. As you have mentioned, Egypt have started the fortification of flour 2010, and it had very positive impact in reduction of anemia and the neural tube defect. But because of the national upset, which happened in 2011, the program have stopped. And we could see from our statistics in 2014 in comparison to 2021 that anemia was 27% in children below 5. It climbed up to 43% in children below 5 because we stopped the flour fortification with iron and folic acid. So this pushed and also the lactating mothers and the pregnant mother, it came up to 47%. So half of the Egyptian women were suffering from anemia because the fortification was elective rather than it's a fortification of food. And it was going like a supplementation, only a supplementation in the period of pregnancy and sometimes in lactation. So Egypt moved forward for fortification of flour with iron and folic acid. And the World Food Program support evidence generation to inform the evaluation of the program in collaboration with the National Nutrition and Institute and the Ministry of Health to evaluate the impact of the program in contributing to enhancing consumption of iron and folic acid by the dark-headed population. What actually we do in this process of fortification, we have a micronutrient mix we call the premix. And the premix, comprised of iron and folic acid, was primarily imported from internationally certified suppliers that comply with the WHO quality standard. However, local entities are involved now in blending and distributing the premix under controlled condition, ensuring supply chain efficiency and quality monitoring. To ensure sustainability, Egypt had established a dedicated flour fortification fund, a domestic fund, because you know all that there is now limitation of support. So the domestic fund, through public-private partnership and government allocation, this fund subsidizes premix cost for flour mills and supports quality assurance and monitoring. It has been instrumental in expanding coverage and maintaining affordability, particularly for small and medium-scale mills. To further improve fortification quality, the Ministry of Health has collaborated with the National Nutrition Institute and Cairo University to implement stringent compliance monitoring and capacity building. In 2024 alone, for over 500 food producers were trained in the fortification standard and the quality control, strengthening the enforcement and the sustainability. Additionally, Egypt has combined this fortification effort with national-wide nutrition education campaign delivered via a program which call it Family Counseling Program, where we get a family counseling room in all the primary health care in Egypt now is 100% coverage with trained counselors who take the mothers from the premarital counseling, and they give a micronutrient supplementation from the premarital counseling. And then again, after they get married, we advise them to postpone pregnancy till they get ready for the baby, and they take again 3 months of micronutrients before getting pregnant, knowing that neural tube is formed in the first 5 weeks of pregnancy. So giving the micronutrient after pregnancy won't prevent all the neural tube defects, which we love to prevent. It's not only the neural tube defect, but also it is the cardiac anomaly, it is autism as well. So we prevent so many, in addition to stunting, which 30% of it happen in utero. So we work on that, and then we continue fortification in the first 3 months of pregnancy as well. And then we go to multi-nutrient supplementation. The significance of folic acid fortification cannot be overlooked. Neural tube defect, including spina bifida, occur in Egypt at incidence of 5 per 1,000. And according to recent study mentioned by Khalifa et al. In 2015, these birth defects are largely preventable through adequate maternal support from before conception with folic acid. Egypt's fortification effort has contributed to a gradual decline in the incidence of such a defect, and it was because they take the folic acid. Even before fortification of flour, we were giving the folic acid alone, and this is lead to neural tube defect reduction according to Egypt Ministry of Health and Population 2023 report. Additionally, nationwide public awareness campaign has been done for folic acid supplementation by UNICEF Egypt and mentioned in UNICEF Egypt annual report. Going from the multi-nutrient supplementation, Egypt also had succeeded in iodine supplementation of salt. And really, it is a long story over from 2000 till now. And actually now you can find that all the household salt is iodinized, and we could have contributed to near elimination of iodine deficiency disorders, improve cognitive disorders, and reduce goiter prevalence in Egypt, particularly among school school-age children. And this is according to WHO UNICEF Joint Iodine Deficiency Report 2019, sorry. So to cut the story short, and the last supplementation is vitamin A supplementation, which really we had very high incidence of blindness in children, and with vitamin A supplementation provided for all children under 5 with the micronutrient powder, we could reduce a lot of the incidence of blindness among children starting from 9 months of age. We give the supplementation starting from 9 months of age. To close, from longest experience with babies, we need to work very hard together. Use the moment of the WHA 78 to build the legacy of inclusion, action, and transformation, where no child in Egypt or globally left behind, and prevented from the benefit of micronutrient supplementation and fortification. Thank you.
Thank you, Professor Alalfi, for sharing these important reflections from your journey in Egypt. And I will also come back to you before we close out this panel. Turning now to Dr. Malik Safi, advisor to the Ministry of Health in the Islamic Republic of Pakistan. Dr. Safi, what successes with large-scale food fortification in Pakistan would you like to highlight for this audience today, in person and online?
Thank you very much for providing us the opportunity to share our challenges as well as what we have been able to do. Being a multi-sectoral issue, so nutrition has remained an orphan and not being taken up as a very serious was Planning Commission and other ministries. They have been engaging within the food for the food and nutrition and all these aspects. So I would be sharing few key areas of interventions which Pakistan has been doing. We are, I think, well aware, all of us, that Pakistan is facing huge challenges within. We have a high stunting of around 37%, and wasting as well. And then anemia in mothers is around 47%. Similarly, it goes for the children. And it's very difficult to, and being a rural community, almost 60% of our population, they are living in rural areas. So this micronutrient deficiency and its effects, they are there. So in order to address this, with the support of partners, UNICEF, WHO, and other partners, Pakistan has been able to make significant progress in advancing large-scale food fortification programs as a strategic intervention to combat widespread micronutrient deficiencies. So I'll quickly share a few success stories which stand out. So over 80% of households now consume iodized salt, and more than 80% of edible oil or ghee, which we call, is fortified with vitamin A and D. So this marks a significant public health achievement for us. It started off in early 2000, and within a span of few 1.5 decades, so we have been able to make some huge progress. Similar was the case with Universal Salt Iodization Program, alone, which increased iodized salt coverage from 17% in 2001 to almost around 80% in 2018 and onwards, which is resulting in a measurable reduction in iodine deficiency disorders, the special goiter, and that has significantly reduced. Then another issue which was addressed was the legislative backup. for mandatory food fortification legislation. It has been approved in 3 provinces. We have 4 large provinces. So 3 provinces have now legislation in place, and the 4th one is under process of going through. Under the industrial and government's collaboration, it was funded by DFID, the UK government's food fortification program from 2016 to 2020, in which almost 2,500 micro feeders were installed across 992 flour mills, and 120 small scale chakis were equipped in 100 districts. So we have around 150 or 60 districts. So in 100 districts, these were placed, including our very far off areas like Gilgit-Baltistan, which is in the north. So these efforts extended fortification beyond large industries to small scale producers, who account for 63% of the national flour market. But still, this remains a significant challenge to engage chakis in villages and across small towns, as our almost 60% population is there. And then capacity building and quality assurance. So over 1,000 officials and industry stakeholders, they were trained in fortification techniques, food safety, and use of quality assurance tools like spectrophotometers. Additionally, 3 PFMA laboratories were also upgraded to monitor and support compliance with fortification standards. To biofortification and innovations, in which Pakistan also advanced the zinc enriched wheat and has adopted WHO's standard for rice fortification as well, and has demonstrated a multi-pronged approach to tackling micronutrient deficiencies. Institutional strengthening. Ministry continues to provide leadership by promoting policy coherence, strengthening standards via the PSQCA under the Ministry of Science and Technology, and enhancing public-private partnership through programs like the wheat flour fortification programs, which integrate real-time monitoring and regulatory enforcement. So what earlier I said that it remained as an orphan. So in order to take the responsibility, ministry is now developing its national health and population policy for the next 10 years, from 2025 to 34. So in this, out of 10 areas, the key areas, one area is the nutritional aspect, which we would be highlighting within the national policy, because then provincial governments, they also link up with the national policy, and that's how we would take the ownership of this very important area which has been missed out earlier. So this is a significant step which government of Pakistan is now taking. Previously, because of its multi-sectorality, so it fell between the cracks, that who's the owner, who will be the main responsible person. So another important area was that we have developed the essential package of health services for the primary health care, community, and secondary care levels. So based on the Disease Control Priority 3 program at the World Bank. So those interventions now include key nutritional interventions as well. And we have around 84,000 lady health workers program within our community. So they are covering around 60% of our rural population. So through them, we have revised their curriculum and we have included these micronutrient issues and what the remedial measures or advice they would be giving, they would be referring. So these aspects have been covered through our healthcare providers at the primary healthcare level. So I think as 60% population goes to the primary healthcare setup, so as soon as we roll out this essential package of health services and this this health and population policy comes into play, so definitely there would be much more difference and improvement. And I think the key messages are that food fortification saves lives and it is preventable. Thank you.
Thank you, Dr. Safi. A journey when it's not easy, it's good to look at the successes already made. And on that note, I thank also all of you very much for all you have shared with us so far. But we have heard what you have done, but we're also interested to look a little bit ahead of us in the future. So before we let you go, maybe you could share with us a brief reflection on the road ahead on food fortification in your country's context, and what new initiatives or goals will you pursue, or what key challenges will you tackle? And I would like to start with Professor Jaffor.
Thank you very much. The government of Bangladesh, in collaboration with international development partners, including Global Alliance for Nutrition, Improved Nutrition, is actively pursuing new initiatives to prevent spina bifida and other neural tube defects. Developing goals, Bangladesh has demonstrated a strong commitment to addressing the micronutrient deficiencies, aligning with the Sustainable Development Goal, the Nutrition for Growth, Summit commitments, and the resolution of the World Health Assembly. The Ministry of Health and Family Welfare has been actively involved in various initiatives, particularly focusing on large-scale food fortification as a key strategy. Key initiatives that country has already taken can be summarized as folic acid supplementation. Folic acid is well established as a preventive measure against spina bifida. The government is working to expand folic acid supplementation program for women of reproductive age, especially in rural and underserved areas. Government also working to promote multiple micronutrient supplementation in Bangladesh to prevent multiple micronutrient deficiencies. Expanding the scope of mandatory food fortification, advocating for the inclusion of more staple foods and condiments under mandatory fortification with essential micronutrients like zinc, iron, folic acid, vitamin A and D. Beyond the current focus on the sulfur iodization and vitamin A fortified eligible oil, for example, preparatory tasks are underway to amend the existing standard of mandatory edible oil with vitamin A and D and exploring the addition of folic acid to iodized salt. There are also discussions around mandatory folic acid fortification suitable foods such as rice and wheat flour to ensure broader population coverage. Community education and maternal health programs. The government is integrating neural tube defect prevention into maternal child health services, including antenatal care. Educational campaigns are being rolled out to inform women about the importance of early folic acid intake, ideally before conception. The government is expect to update the national strategy for prevention and control of micronutrient deficiencies 2015 to 24, beyond 24, and potentially expand mandatory fortification policies. The National Food and Sustainable Solution of Reduced National Food and National Security Policy 2021 to 2030 also outline a long-term commitment to food fortification, including folic acid as sustainable solution to reduce the renal tube defects and then birth defect related complications. Despite progress, folate deficiency remain a concern, with 90% of women found deficient in the National Micronutrient Survey 2019. 2019, there is growing advocacy mandatory folic acid fortification of staple foods such as wheat flour, salt, and rich to reach the broader population base. What I believe, what we believe, I'm not alone, you are not alone. We are all together, nothing is impossible, we will be possible, inshallah. Thank you very much.
Professor Lalfi, same question to you for a brief reflection on the road ahead of us.
Okay. As I have mentioned, that the program for fortification of flour, this is we call it the fortified baladi bread, have been started since 2023, and we target to cover all the unfortunate and the unprivileged population. This is how we can do that. We work through the Ministry of Supply and Internal Trade under the National Food Subsidy system. So through this program with the World Food Program, and the government, we fortify the subsidized baladi bread, providing on ration cards under the food subsidy system with iron and folic acid. So make sure that this bread reaches to every unfortunate family in the country. The National Food Subsidy system targets the most vulnerable families through the vulnerability index that is identified by the government and encompassing socio-economic and food security indicators. Having the program being implemented under the National Social Protection System through the food subsidy ensure that the program is primarily reached the poorest and the most food insecure. The government is also enhancing the target system to further ensure reaching those most marginalized and in focus on enhancing the integration of all social protection programs to maximize the impact of the most vulnerable. This is one issue to cover all the vulnerable. The second issue in our plan to monitor and digitalize all the system being applied, so make sure of the success and the maintenance of the program. The third issue, which we are focusing on, that we reach to every baby before he is born, and this is through the national program for covering all the newly born. And even on 12th of May, 2025, we have launched the national program for prevention of stunting and malnutrition and neural tube defect by combining three major issues, which are health, supplementation and fortification, and social protection. So we concentrate on examining the children and following them up with the specialized people in the primary health care. In the same time, we detect the unfortunate and to give them social protection, and we give all the nutritional awareness, counseling, fortification, and supplementation as well, starting from the premarital age group. Last point, that we know that 70% of our population are being treated in the private sector. And this is, again, a period where we can miss a lot of people. So we try to engage all the newly born in the primary health care, cover them, and reach those who are not coming. We can get them back with the community health workers. And then at the same time, we digitalize to get all the private sector interconnected with the national system. So make sure that every child being followed up in the private sector have his rights in being supplemented with the micronutrient. Actually, I would love to end with, again, that we worked in Egypt for last, maybe from 2018. And in one study we have done, we could come down in the unprivileged areas with stunting, which was 31% before start, the baseline, and with fortification, social protection, counseling, and continuous monitoring and follow-up, we came down for the group which we followed up from early pregnancy to 3%, and for group which we followed up immediately after birth to 4.5%. So it is doable, it is preventable, and if you live with a family of a child with spina bifida, even if you have the best neurosurgeon in the world, you will come out with a child who is mentally intact, but maybe he's not moving or he is really suffering. So I'm really supportive to the maximum for this movement toward this micronutrient supplementation.
Dr. Safi, please share with us your reflections in a brief manner.
So thank you once again. So building upon my previous discussion, so we strongly believe that large-scale food fortification as a cost-effective and sustainable strategy to address widespread micronutrients deficiencies. And building upon this momentum, the road ahead, we would like to focus on consolidating our legislation process. One of our province, which is Punjab, it's the largest province, almost 50% of our country. So we'll be pushing them for this legislation laws. And then once laws are there, so then they need to be implemented. Rules, regulations are then made for it. So that process has to be done. Then another important regulatory enforcement process has to be built in to monitor the system and see that the population is not being cheated. And actually, there's fortification of food, which they say that's happening. Then continued investment in training programs for policymakers as well, and also the those persons who are involving that. So those are. Then public awareness is another key area which needs to be there, and to enhance the demand from the community side that they would like to have this fortified food and its importance. So that's why the community-based Lady Health Workers program, we have revised their curriculum as well to train them, to engage them in this aspect. So this would be very important, and this would definitely improve the impact, and with particular emphasis on maternal and child health outcomes. Then during this current World Health Assembly session, a resolution is also being put up on digital marketing of breastfeeding substitute. I think most of us will be knowing, and Pakistan would be supporting this aspect, because the commercial entities, they are trying to sell their commodities to the digital marketing. So this would be a step towards so another aspect about integrating chakis, which I earlier mentioned, it's difficult though, but we need to, and we would be focusing on this. And it contributes 60% of our national production, but remains largely unregulated and under-supported. So this would be very important. And it would be our main objective to bring these producers into formal fortification framework through targeted technical assistance, provision of equipment, and development of policy incentives. Then another critical priority is to taking the private sector, particularly the milling industry, fully on board, because without them, it won't work. So this would be a priority for us, and for ownership, collaboration, fortification programs. So without private sector, we won't be having success. So this means that we need to establish transparent public-private dialogue mechanisms, regular interaction, aligning incentives and supporting innovations in fortified product development. Finally, ensuring women's meaningful participation throughout the value chain from production to policy will be vital for achieving sustainable and inclusive progress in the fight against malnutrition. So these are few key areas which government of Pakistan will be focusing on. Thank you.
Thank you. And your commitments reflect hope for the near and further future. And thank you really for engaging and insightful discussion that we now already had. But your invaluable support is even more important for this event and also in the days and years ahead of us. Please join me all for thanking the panel. I want to ask the panelists to remain seated while we also have the next speaker coming up. But please warmly thank the speakers. It is my pleasure to introduce Victoria Sandoval. Victoria is the president of the International Federation for Spina Bifida and Hydrocephalus. I can say a lot about her work. She is above all a passionate advocate, a global leader in advancing prevention, but also care and inclusion for people affected by spina bifida and hydrocephalus. And under her leadership, the Federation has been now a powerful voice in the global movement linked to nutrition and, of course, especially folic acid fortification with the prevention of neurotube defects. So please warmly welcome Victoria, and the floor is then yours.
Thank you very much. Dear estimated delegates and participants, I salute you as a person living with spina bifida myself. For this reason, being here today and speaking about micronutrients, preventions, and rights it is a deeply interesting topic for me, because we are here discussing is not just a matter of public health. It is a matter of justice, of equity, and human dignity. For decades, the science has been clear. Fortifying staple foods with folic acid is the most cost-efficient and morally policy to reduce the risk of neural tube defects, including spina bifida, guaranteeing a return on investment. This is no longer a theory. It is a proven fact. The International Federation for Spina Bifida has long been the forefront of this effort. Since the evidence emerged on the critical role of vitamin B9, we have worked incessantly to advocate for large-scale food fortification. From a global perspective, 94 countries have now adopted a legislation requiring mandatory fortification of at least one industrially milled cereal. This success did not happen by its own. It is the result of the collaboration between governments, grain millers, vitamin and mineral suppliers, international organizations, and the academic institutions. It reflects a shift in the thinking that fortification is no longer seen as a simple technical requirement, but as a vital contribution to the public health. The adoption of the WHA Resolution 7619 marks a milestone in the regard of and represents a transformation in how we address malnutrition and prevention for the first time combines policies on health, nutrition, and disability. However, its impact becomes visibly over the long term. Moreover, the fact that it requires substantial political change presents an additional barrier. These challenges cannot be tackled by the civil society alone. They require coordinated efforts involving both public institutions and the private sector. As the umbrella organization for our global community, our mission is not only to prevent, but also to ensure that prevention is pursued with full respect for the rights of persons with disabilities. This also means challenging harmful narratives. For too long, women have been left alone to bear the burden of preventing neural tooth defects, facing blame, stigma, and isolation. This is no longer acceptable. Me, as a mother and having spina bifida, I do not blame my mother for this condition. Societies must be considered responsible for creating a healthy and protective environment for every child, starting from conception. And the WHA resolution represents a first impact step in this journey. The first report on the implementation of this resolution will be published on 2026. We have still, but also only 1 year to act. This is the moment to step up for our actions, foster effective implementation, and strengthen our advocacy effort. So today, I call upon you, the governments, to adopt strong national policies rooted in the scientific evidence and backed by the communities. To the private sector, become active partners in public health. To the civil society, keep raising the voices of those who live every day with the consequences of inaction. And to the global community, do not forget that prevention does not exist without inclusion. Each one of us can make a difference. Together, we can make change happen. A change in how we understand human rights-based prevention, not as a luxury, but as a right. Thank you very much.
Victoria, we want to thank you for those. We want to thank you for those very heartfelt comments that remind us that there is no victory here without inclusion, and that I think it's essential that we always keep it forward, that while we're very dedicated to fortification, we're also very dedicated to care. And we're very dedicated to care not only in infancy, but increasingly across the lifespan, because as we recognize our successes clinically, we're seeing more and more people surviving into adulthood, and we need to support those people and not abandon them. And I know there are many great programs. I know some of the neurosurgeons in your country. There are countries, and each of you have them. So it is wonderful, heartfelt comments. Let's give another round of thanks for this panel. This is a spectacular panel. So we're going to have this panel please take their seats, and we're going to shift gears a little bit here. And we're going to have a second panel come up here in just a moment. So as countries strengthen their nutrition and fortification strategies, understanding where micronutrient gaps exist and how fortification can fill them is essential. So this discussion now is going to pivot a little bit toward experts who are leading efforts to generate better data, target interventions more carefully, and ensure that food fortification delivers maximum benefit to those who need it the most. So I will introduce our panelists as they take their seats. Please join me. We'll collectively welcome them at the end. First, I would like to welcome Dr. Saskia Depa. Senior Advisor, Analytics and Science Senior Advisor, Analytics and Science for Food and Nutrition at the World Food Program. Dr. Shruthri Syriac, Senior Program Manager at the Micronutrient Forum. Dr. Svenja Yongyao-Han, Senior Technical Specialist for Knowledge Leadership at the Global Alliance for Improved Nutrition. And my colleague, Dr. Anastasia Smith from the University of Alabama. Let's welcome the panel. We go first to Dr. Saskia Depay, who will speak about a WFP initiative to map and predict micronutrient intake gaps. Saskia.
Thank you very much, and good evening, maybe good morning, good afternoon, people elsewhere in the world listening in. From the WFP side, I would like to share a glimpse of what we do using existing data to identify the need for micronutrient interventions. And the need, where is the need high, amongst whom is the need high, is the need changing? That's what we look at. So we have two major analytical approaches that I like to highlight. One is called the Fill the Nutrient Gap, where we use cost and affordability of diet metrics to assess for whom is it hardest to have a diet that can meet health and nutritional needs, and therefore needs for micronutrient interventions will be high. And I'll show you some graphic examples of that. We've got a new platform for those analyses called Enhance. And we've got a new initiative together with the Gates Foundation. It's called MIMI, and it's the abbreviation of Modeling and Mapping the Risk of Inadequate Micronutrient Intake. We use household consumption and expenditure data for that. So we can estimate the risk of inadequacy subnationally among different target groups. We can assess the potential impact of nutrition interventions through modeling. So if we model fortification, different specifications, different levels, different compliance, we can assess what the impact can be. We can also assess the risk of the reduction of the risk when we use social assistance mechanisms to provide fortified food. We can model scenarios, different standards, different levels of compliance. Equity, are the most vulnerable being reached? And also the safety risk. Now, which questions are addressed is decided together with stakeholders in country. So the method is really meant to look at how can we support the best adaptation, the best introduction of fortification programs and other micronutrient deficiency programs. If I can have the next slide, I'll show you, this is a mapping that we do with the MIMI program. So you can see here for Ethiopia, the risk of across all micronutrients of deficiency across the country. And then when wheat flour is fortified or when edible oil is fortified, you can see a reduction of the risk because the color of the map is changing. You don't see red anymore, you see less bright yellow. And if they are coming together, there's an even greater risk of reduction. With those modeling, we are also developing predictions. So we are looking at indicators that can predict the risk. I'm not showing you results of that, but just so you know, we're also doing this for countries where we don't have as rich data available, or for in-between periods when situation changes, so we can have predictions. Here we are looking at who can benefit from fortification. So this is the base case is the circle, the orange circle, and then with the fortification of wheat flour and edible oil, you see the adequacy ratio increasing to the right. And we look at it for urban areas. So you see 5 different income quintiles. You see the shift, and you see that the poorest in the blue line in the middle, there the impact is the greatest. They can benefit the most from that fortification, reducing their level of inadequacy. For rural, the set below, it's somewhat different, and that's because they have less access to these vehicles in the market in the rural areas. And now I'd like to turn to the application of cost and affordability metrics. So this shows you an expenditure curve, and it shows you two lines of a cost of diets. So the lowest line is the cost of just meeting energy needs, and the line above that is the cost of a nutritious diet. And you can see a proportion of the population's expenditure is too low to reach that. So those people will be food insecure and at a risk of inadequate micronutrient intakes. And the bigger the gap, the bigger the risk of inadequacies. So with social assistance programs, can I have the next slide? And many social assistance programs, they provide a cash transfer. But we heard good examples from Bangladesh and Egypt today, where there is also a specific intervention to increase access to foods, nutritious foods. So that's on the next slide. So now we are reducing that affordability gap from the income side on the bottom and from the top by providing access to more nutritious foods. And that's what you can do when you link your social assistance programs to deliberate interventions in the food system. So this is conceptually how you can drive down that risk. And then the last slide shows examples of scaling up the use of food fortification, and especially through social assistance programs and through humanitarian assistance. And I'd like to say one point about the humanitarian assistance. To have access to fortified foods for the distribution, we really rely on countries having food fortification in place at some scale. Because it's very hard to source centrally and take it to many countries. So yeah, thank you very much for your attention.
So, Saskia, thanks so much for those comments. I think they remind us that while we all embrace the notion of fortification globally and holistically, this gives us the granularity to really look at it and see how effectively we're doing it, and recognize that even in countries that are leading, like Ethiopia right now, there still will be challenges. There still will be pockets where it won't come easy, and there will be successes and there will be continue to be challenges. Wonderful. Well, Saskia, thank you. Next, we will hear from Dr. Shruti Syriac on from the Micronutrient Forum about the Global Fortification Data Exchange.
Thank you.
Shruti, please.
Thank you. Good evening, everyone, and good day to everyone who's watching this online. I'm here as part of the Global Fortification Data Exchange. We are a collaboration of 4 expert organizations that put together data on fortification. In the GFDX, fortification data is visualized and disseminated to provide insights to country-level stakeholders as well as for the global fortification community. GFDX makes fortification data easily available and accessible to anyone who wants to have insights about their country's fortification status. GFDX has 3 main components. It's data, product, as well as utilization. When you look at data, we have national level data available for 196 countries on 5 food vehicles. So we have maize flour, oil, rice, salt, and wheat flour. The product that GFDX is has is the GFDX website, which essentially visualizes the global maps as well as country dashboards. And we also have analysis as well as interpretations of what these maps mean that are easily accessible to the GFDX user. And finally, for the utilization, GFDX wants the GFDX user to get these insights and take it to their national level decision makers and provide insights to make data-driven decisions on fortification. So for this, all of the, Ludi, if you could go back to the previous slide for a second, all of the data sets are freely available, and a new version of the website will have a translation facility available for close to 100 languages. In the next slide, I will show you all of the different indicators that the GFDX has. And this might be overwhelming at first, but just to orient you, there's 3 boxes here. Each of this is an indicator category. Fortification opportunity essentially looks at whether there's a good opportunity for any food vehicle to be fortified. And we look at different types of indicators: food intake data, the proportion of food industrially processed, as well as the proportion of population consuming that food to tell you if it's a good food vehicle to fortify or not in your country. The second set of indicators looks at foundational documents. So these are essentially the legislation or regulatory documents in your country and whether there's a good fortificational foundation for fortification in your country. And thirdly, the program performance looks at compliance of fortification programs, the coverage of fortification programs, et cetera, to tell you how well fortification programs are implemented in your country. So in the next slide, you will see an example of what a country dashboard looks like in the GFDX. So if you are a country that wants to understand how many foods of the 5 food vehicles are fortified, you would go into the foundational document and you'll check. And in this example, you'll see oil has mandatory fortification since 1960. I can't really see the last part of that date, but you'll see that fortification is mandated for oil. Now, if this country wants to look at an additional food vehicle to fortify, they would then go into fortification opportunity indicators. And you see here that salt is indicated as a good opportunity. So between maize and salt, you would choose salt as a second vehicle to fortify. And in my final slide, you will see the national fortification standards compared to the WHO guidelines for all the countries in the world. And this is where you can see on the right-hand side, there's drop-down filters where you could choose the different food vehicles, you could choose different nutrients, and then at the bottom right, you'd see a toggle function. So between the map, you could toggle to data and get spreadsheets and interact with that data for your own insights. And then finally, you hover over any country and it'll pop up with additional information. So you get the full sort of full breadth of data insights from the GFDX. And the next slide, you'll have information on how to access our website. So please go to fortificationdata.org, look at your country dashboards, and then if you have any questions or insights to share, please write to us. We are launching a new website in the next couple of months, and we will have a data collection survey coming up in the next few months as well. So please stay in touch and look at your country dashboards. Thank you.
Wonderful collaboration and real actionable intelligence to charge everybody with going and looking for your own country and then writing back. It's just fantastic. Thank you, Shrewdbury. Really great. Okay, now we'll pivot. Dr. Svenja Young-Johan will talk to us. We'll share a new research initiative to estimate the potential impact of large-scale food fortification programs on micronutrient deficiencies. Svenja.
Yeah, thank you very much, and hello to everybody in the room and online. So I'll be presenting the work and on behalf of the team that you can see on the screens right now on the estimating the global impact of large-scale food fortification programs on micronutrient inadequacies and implementation costs. So large-scale food fortification, or LSFF, is widely adopted with 150 countries as per GFDX having legislation in place. And these programs can significantly reduce inadequate micronutrient intakes with the many related health benefits if they are well designed and implemented properly. But the true global impact and potential for improvement still remains largely unknown. So this estimation model assessed these 3 scenarios, one with no fortification, one with reflecting the current programs as implemented, and one where compliance of the current program is increased to 90% across all programs. So daily micronutrient intake and inadequacy prevalence across 34 age and sex groups was estimated, looking at 13 essential micronutrients and across 185 countries. Yeah, so exactly in this slide, you can see that the analysis shows that current large-scale fortification programs are already preventing 7 billion inadequate micronutrient intakes globally, which is significant impact achieved particularly through, as you can see, iodine and iron. And the number of people with inadequate intakes was also estimated under each of these fortification scenarios, showing that despite the impact of today's programs in place, 38.8 billion inadequate micronutrient intakes remain each year. So while fortification is powerful, there's significant room for improvement. And so if we raise the compliance to 90%, we could prevent an additional 6.2 billion inadequate micronutrient intakes. The biggest gains would be coming from vitamin A, with 1.1 billion additional people getting more of this essential micronutrient. And these improvements would particularly benefit countries most vulnerable to malnutrition and where the need for cost-effective intervention is greatest. So large-scale intervention are low cost. Estimated costs are range from 1 cent to 12 cents per person per year. Under improved compliance, per capita annual cost of wheat flour and rice fortification would be more than triple, while costs increase for maize and rice fortification, maize would be around 2%, and oil and salt would be under 1% per capita. So even with improved compliance, this represents just a fraction of the cost of the healthy diet, which is estimated at $1,445 per year per person. So in summary, large-scale fortification is already making a major impact, avoiding 7 billion micronutrient intakes per year, but we could nearly double that with just improved compliance. So this shows that as we work towards a long-term food system improvements towards healthy diets, large-scale fortification remains a vital and cost-effective solution. Thank you.
Wonderful, thank you. Finally, fortification is inherently requires a vehicle, right? The folic acid has to ride on something. And now my colleague, Dr. Anastasia Smith, will speak about what we think is a potential game changer, double fortified salt.
Thank you, Dr. Blount. Good afternoon, everyone, online as well. And as mentioned, I'll give you an update on the promise of the double fortified iodized salt with folic acid. Next slide, please. So the current prevention efforts, as reported fairly recently, showed that only about a quarter of the spina bifida and anencephaly cases are prevented. However, a great modeling study by Dr. Vijay Kancharla showed us that we could prevent additional 65% if we were to fortify salt. So, and as you can see by the maps, it would overlay really nicely with the current fortification of wheat and rice and other vehicles, and it would be a nice complement. So why salt? Next slide, please. Next. Anyway, I think it skipped a slide, but anyway, but why salt? Salt is because it's cheap. Everyone eats it. We already have centralized processing of iodization of salt. So the infrastructure is there in place. So there's been three actually clinical studies that have looked at fortified salt and its effect on the folate levels in women. The first study on this slide is from the US that our group did. It was very simple, provided salt for women that had folic acid in it, and we measured their folate levels before and after in the setting of current fortification in the US, where we have a wheat flour fortification. And it still showed a significant increase, as you can see by the graph. The graph on the right is from a great study from India, from Dr. Vijay Shekhar and his group with Dr. Yogi Patisapu. And their data showed more than tripled increase in the folate levels in the women. And that is in the setting of no fortification at all. So you can see the impact that fortification of salt could do. The third study is currently being done in Ethiopia, and we will get those results hopefully very soon. Very excited about it. But more importantly, data is great, but what about the population? What about people who are actually consuming the salt, how do they feel about it? Because there's a little bit of a yellow tint to it, depending on the concentration of it, folic acid in the salt. So the Indian study showed the exit polls that it was highly acceptable. It was very good. There was no complaints from participants. The US study showed that there was more than 90% of the participants said that the color and the taste did not affect how the food tasted, nor their desire to use it. And then the Ethiopian study also showed very similar results. No women exited the study due to their non-acceptability of the salt. So we can tell that from the participants, there's no issue with the taste or color of the salt. So the final conclusions is that these studies have showed that there's a meaningful increase in serum folate, which is what we want to prevent neural tube defects. The taste and color is highly acceptable. Salt could potentially be a great complement to the current prevention efforts through various other fortification vehicles. And it definitely holds promise for global fortification efforts. Thank you.
And we'll keep the program moving. Regrettably, we don't have time for questions or further development, but we will invite and ask you to seek out these speakers at the refreshment time at the conclusion of this program this evening. We're moving along nicely. We're going to pivot again. Our next talk, we're going to talk about some short testimonials from the fortification journey, and we're going to welcome a couple of new speakers, please. Dr. Salima Al-Mamari is the Director of Nutrition and the Minister of Health in the Sultanate of Oman. And Ms. Mary Muthoni Muriki is the Principal Secretary in the State Department for Public Health and Professional Standards in the Ministry of Health in Kenya. Greetings to our panel and thank you very much. Dr. Salima, if you would, the Sultanate of Oman has achieved remarkable results through its food fortification program that was launched in 1997. In your view, what have been the key factors that enabled such effective and rapid implementation?
Thank you very much for inviting us to be part of this important session. And good afternoon, everybody, including those online. The success of Sultanate of Oman Food Fortification Program launched in 1997 can be attributed to several key enablers that worked in harmony to deliver rapid and effective implementation. First and foremost, the program was backed by strong political will from the very beginning. This unwavering support laid a solid foundation for the fortification to become a national priority. And importantly, it was made mandatory early on, demonstrating a clear commitment to the public health. One of the most crucial elements in the implementation process was early and open communication with the private sector stakeholder, especially the flour mills. The manager of the mill supplying 80% of the Oman flour was not only well informed, but fully supportive of the program after understanding the positive impact of fortification could have on the health of the population. This buy-in was instrumental. Another important factor was the active use of national media to inform the public. Building awareness and consensus through transparent communication help ensure public trust and acceptance of the fortified food. The swift implementation was also made possible because Oman already had a well-established flour industry. No additional equipment, supplies, or manpower were required, just the procurement of the fortificant. Multi-sectorial collaboration played a vital role throughout. Ministries, industry leader, public health experts, and international partners work together with a shared vision. The program was also supported by continuous monitoring and surveillance mechanism. And we are lucky that we have data in place, which were the key to its sustainability. Regular registration of the neural tube defect cases helped track progress and provided compelling evidence of the program success. So from 1997, we have the data of the even before the neural tube defect, and we have regularly, annually in our Shifa system. So this feedback loop reinforced the commitment among food manufacturers by showing the real-life impact of their effort in reducing the neural tube defect and improving pregnancy outcome. I usually visit them and give them presentation so that they will feel that it is not, fortification is not a burden, it is saving life for the community. Food fortification has proven to be cost-effective and highly impactful strategy for improving maternal and child health. In Oman, the mills has always been credited with the ownership of this success, and their role in saving lives and alleviating the suffering of the families has made this truly collaborative public health victory, one that continues to inspire both nationally and globally.
Thank you very much, Dr. Salima. Ms. Mariuki, would you please tell us about the Kenya's fortification journey? How are you planning to strengthen Kenya's food fortification in the years ahead?
Thank you very much, ladies and gentlemen. First and foremost, it's really a pleasure and honor to represent Kenya in this very important event. Micronutrient deficiencies affect over 2 billion people globally, and in Kenya, 52.6% preschool children face marginal vitamin A deficiency, and 41.6% of pregnant women are anemic. Therefore, zinc and iron deficiencies also remain prevalent as a public health concern. Kenya has a long-standing commitment to food fortification, and we began with mandatory iodization of salt in 1978, which contributed to a significant decline in the total goiter rate from 16% in 1994 to 6% in 2004, and moving onwards. Today, 99% of the Kenyan household consume adequately iodized salts. In 2012, we mandated fortification of prepackaged maize and wheat flour and edible oils. And these foods are fortified with vitamin B complex, vitamin A, zinc for the flours, and vitamins A, D, E, K for edible oils and fats. Since then, wheat flour compliance has improved from 18% in 2017, and those are many years ago, to 84% in 2021. And so is maize flour compliance, which has increased from 16% to 46%. To expand, we are piloting the rice fortification, strengthening multi-sectoral coordination through the Kenya National Food Fortification Alliance, and building laboratory capacity for quality assurance at the National Public Health Laboratory. And equally with academia, we have Jomo Kenyatta University of Agriculture and Technology. So this collaboration is assisting us in having a way forward to keep increasing these issues. And we recognize the challenges that have existed, sometimes such as outdated micronutrient data, limited funding, enforcement of gaps and barriers for small-scale millers. But yet we remain very focused because fortification is a very key part of the Kenya Nutrition Action Plan and the universal health coverage and nutrition for growth commitments, which is being advocated at the community level by over 107,831 community health promoters across our 47 county governments. And these are individuals who move from household to household. And their work is to identify some of these mishaps and gaps that we have in our communities and refer them possibly to formally skilled people who can be able to assist. Therefore, our community health promoters are playing a very, very key role. We equally have been able to map our primary care networks, the grouping of health facilities that are near us, so that we are able to also to distribute whatever commodities that we may have to the hard to reach areas. And the rolling out of the universal health coverage that we are having in our country, again, primary care, primary health care is playing a very, very key role. And that is why Kenya has been able to really move steps. We urge the global and regional partners to support innovation, strengthen local industries, and expand partnerships to accelerate progress towards the global nutrition targets. We do not live as aliens, as countries, as we must collaborate. SDG 17 talks about partnerships, and we must ride on that so that we achieve that which we are looking forward to. Thank you, and I look forward for the continued collaboration. Thank you.
Thank you to both speakers, and what a great energy and actions, intentions, and moreover commitments for what after this meeting is going to happen. But with passion also comes time, but we're not yet at the end. So for the people online and also in the room, please put your eyes up bright because we are going now to the final panel group. Thank you once more. And the final panel consists of 2 people. And I'm going to introduce them to you. This final panel highlights the vital collaboration between donors, public sector, private industry, and civil society to advance food fortification. We would need them all. And therefore, I would like to welcome Caitlin Smethurst, Senior Program Officer, Global Policy and Advocacy, Gates Foundation. Dr. Jacob Ahmed, Country Director, Regional Foundation, Ethiopia, and also a proud member of the Rotary Club, Addis Ababa West. And while Jacob is also taking his seat, both welcome. It's a tough job that you have in this final panel. We like to brief, motivating words. But Caitlin first, why is food fortification now such a priority for the Gates Foundation? And how does it align with the Foundation's broader goals when it comes to global health and nutrition?
Thank you. Thank you, everyone. It's a real pleasure to be here today. I get the privilege to work with many of you. I'm a super user of GFDX, a proud super user. And yeah, this is a really wonderful event. So we're going to be bright and be brief and be gone because I'd love to actually connect with many of you for those that can stick around. So for the Gates Foundation, investment in nutrition remains a priority because like many of you, we really believe that good nutrition is actually the foundation of health and economic development. We all know the statistics. Malnutrition is a driver of half of all deaths for children under 5. And unlike other statistics, this is entirely preventable. We believe that key interventions delivered at the right time can save lives and begin to reverse these trends. We at the foundation invest in maternal nutrition, including micronutrient supplements. We invest in improving access to safe, affordable, nutritious food year-round. We also invest a lot of time and energy and resources in scaling food fortification. What drives our investment in fortification is simple, and it's actually a sentiment that Luce shared earlier. It's one of the most scalable, cost-effective tools we have to reduce micronutrient deficiencies worldwide, but it is yet to reach its full potential. We're specifically investing in better data and high-quality technical assistance to millers and food producers. We're investing in innovations in R&D and building coalitions of advocates and stronger policies and standards. In partnership with many of you, governments, industry, technical experts, and advocates who I get to work most closely with, we believe we can build and scale programs that really work.
Thank you, Caitlin. And we were a bit surprised because you were short, brief, and to the point, what we like. So that means that we have the data, we have the commitments. So what else do we need to do? Maybe networking. So maybe Jacob, you are now as last, you wear in fact a couple of hats on this panel. As country director of Reach Another Foundation in Ethiopia, you're also involved in advocacy to expand access to fortified stable foods. You are a member in your local Rotary Club, which has also begun to make a difference in spina bifida prevention in Ethiopia. So talking about the role of civil society in supporting effective large-scale food fortification programs and also scaling up, because that's what we're looking at. So please share with us the encouraging journey.
Thank you very much. So I'm from Reach Another. So this is an organization that dedicates entire resource time for prevention, treatment, and management of spina bifida. So along the way, we used to collaborate with so many organizations. So I think I have to mention this very important point that our collaboration with Rotary International. So in the past 2 years, we are collaborating with Rotary International for a prevention of spina bifida with high-risk prevention program with like supplementation of folic acid. But with this specific program, I learned that Rotary International impact can be scaled up in a very, better way, in a huge way, with prevention of spina bifida through large-scale food fortification. Because we all know Rotary International's experience on the eradication of polio. So why not spina bifida baby the next polio? Why not for Rotary International? So that I saw that experience. But as a civic society organization in Ethiopia, civic society organization have a lot of roles, but there are this has many NGOs in this room I can imagine. So I have seen 3 most important things where civic society can focus on. So the first one is advocacy and community ownership. So you would be surprised how many people have no idea about fortification when you talk. They are a very big people in their position, in their organization, but when you talk about fortification, they are new about the concept. So we need to work a lot on advocacy and also creating demand in the community. So that was one very important message that I want to share to all of you guys. The second one is, I think the second panel already explained very well, the panel before us. So what I have seen because I have also worked in a ministry for long years. So data availability, visibility of the information for the decision maker to make informed decision is very important. So sometimes this is hidden under big programs. So how fortification can help in reduction of neonatal mortality, child mortality, maternal mortality, even improving outcome of disease treatment in a hospital. So that part should be very well, explained. So civic society organization can work a lot to make that realized. And the final point is all comes to resource. Those countries like mine, is a lot of competing priorities on the table. So sometimes nutrition, because it's not really visible in the system, and sometimes fortification, it may look like a distant intervention. So it may lack priority on the list. So resource is very important. So civic society organization using their partnership, networking, collaboration, they can bring a lot of resource in terms of technical resource, in terms of financial resource to the country to prioritize large-scale fortification. So I feel this three in my journey are very important to realize a large-scale fortification in any country, I feel. Thank you.
There we go. Thanks to the both of you. We will wrap the program up this evening, and it's my great pleasure to introduce the closing speaker of the evening. Kamel Gatme is a Colombian pediatric neurosurgeon, and he's a global health advocate who's been absolutely instrumental in the successful passage of WHA 7619. It is highly likely that we would not have a resolution but for Kamel's continued dedicated work during the very difficult time of navigating it through the political process, providing the scientific advocacy and whatnot that was necessary. He was instrumental in working with his own government in Colombia and very instrumental with working with the Colombian people here at WHA. You met Luz. The partnership of Kamel and Luz was absolutely central to the success in this. So we all owe a debt to Kamel. So Kamel, would you join with us, please, in giving us your closing remarks on accelerating action through large-scale food fortification in the year ahead?
Greetings, everyone, in person and online. Today, we witness a powerful confluence of science, leadership, and commitment. I want to begin by sincerely thanking our distinguished speakers, including the honorable representatives from Bangladesh, Egypt, Kenya, Oman, Pakistan, and the Philippines, as well as our insightful panelists from diverse organizations and countries. My gratitude also extends to our dedicated co-hosts, UNICEF, GAIN, the Micronutrient Forum, Nutrition International, the G4 Alliance, Helen Keller International, the Iodine Global Network, the World Food Program, GAPS Beef, the International Federation for Spina Bifida and Hydrocephalus, and the Food Fortification Initiative. From all the interventions today, three key messages resonate clearly. First, the evidence is overwhelming. Large-scale food fortification saves lives, prevents disabilities, and builds resilience. The opportunity is within reach. This is my second synthesis from today. Full implementation of WHO Resolution 76.19 could prevent 200,000 neural tube defects cases globally each year, and more than 60,000 pregnancy terminations due to micronutrient deficiencies. This is in addition to the countless instances of preventable micronutrient deficiencies affecting the broader population, including adult and older adults. Third, the momentum is real. The national experience shared today proved that large-scale food fortification is both achievable and impactful at scale. We are not starting from scratch. These experiences shared today show us that we are building on a solid and inclusive foundation. However, for large-scale food fortification to truly succeed, it demands political will, sustainable investment, and long-term commitment, especially in implementation, scaling up, monitoring and surveillance, and of course, all of the actions that will get to long-term sustainability. As we look ahead to the first progress report of the WHO Secretariat in the coming year, I would like to briefly share findings from a cross-sectional study we conducted at the University of La Sabana in Colombia. We analyzed the regulatory status of food fortification across all 194 member states of the UN, triangulating reliable sources such as the Global Fortification Data Exchange, FFI, FAO, and official national reports. Then we use a validated scale to classify the need for regulatory change as urgent, high, medium, and unnecessary. Here's what we found. More than 37% of countries urgently require legislative modifications for mandatory folic acid fortification. 60% require a high level of policy change, and only 1% have a comprehensive regulatory status covering all evaluated staple foods. Asia and Africa show the greatest need for reform, followed by Europe, while the Americas display significant compliance, though with clear room for improvement. Let me leave you then with 3 unmissable takeaways. First, urgency. We have mentioned this here several times. 2 billion people will suffer from micronutrient deficiencies. This is unacceptable, and more importantly, is preventable. Second, equity. Food fortification is amongst the most cost-effective, safe, and equitable public health interventions available. And third, opportunity. The WHO resolution is more than a policy. It's a platform to mobilize global political will. The resolution opens the door to stronger accountability, smarter investments, and more effective coordination. The time to act is now. So we must support governments in implementing large-scale food fortification policies, leverage global partnership as all of those that can be built here today to scale innovation, and ensure that communities are engaged and fully benefit from these policies. So here's our call to the world. Let us speak with one voice. Fortification is a moral imperative and a smart investment. Together we can and we must end hidden hunger. Thank you.
Urgency, equity, opportunity, resulting in a moral imperative. It doesn't get simpler or more direct than that. There's no better way to close it. Sylvia, any comment?
I'm lost of words.
Perfect closure. Kamel, we're in gratitude. Thank you. Thank you to everybody for coming. Let's enjoy some snacks. 1 second. I wanted to, pardon me, before everybody stands, we must give proper recognition to Kristen and the GAIN team for pulling together an utterly exceptional program.